I think it's exciting that you've taken the approach where we are saying how well can we prevent or how well can we maintain good health, because we are happy to take care of uh, our patients when they fall ill, when they have fractures, when they have advanced arthritis and we need to operate on them. But we are happier if we're able to prevent most of the bone illnesses. So just as in a nutshell, the best way we can maintain very good bone health is you start by being physically active. So by being physically active, then you are applying strain onto the bone. And the physiological response to you being active and applying strain on the bone is the bone now strains, or the bone seeks to accommodate the additional strain by adding calcium on the bone, and by so doing the bone is harder. And there's a curve in terms of how hard the bone is or how mineralized the bone is in such that from the time we are teenagers to the time we are in our early 20s, we are slowly increasing the bone density. We are slowly increasing the amount of calcium in our bone. And then we get a peak level which is between the ages of 26 to 31, where that is the highest bone density we'll have in life. And then after that, it starts tapering down. And the tapering down is gradual. And then when we hit menopause for ladies, it starts being a little bit rapid. For gentlemen, when we hit around 65, we also start having a rapid decline in our bone density. And therefore, for us to be able to have good bone health, then we have to be physically active when we are young, so that we are running, we are jogging, we are engaging ourselves in soccer, is it basketball. Any activity that puts strain on the bone will stimulate the body to deposit more calcium. And number two, when we have instances where the demand for calcium is increased, for example, when a mother is expectant, they lose a significant amount of calcium to the baby. And therefore, it is advocated that when one is expectant, that we take calcium supplements, so that the calcium going to the baby is largely from the calcium you are taking in and not from your own bone density. Because if it's from your own bone density, then you see the density of the bone going lower and lower with every pregnancy. But if you take calcium supplementation, then the baby will get enough calcium, most of it from the supplementation and very little from the mother's calcium. And after that, even after the age I've talked about of 26 to 31, if we maintain high physical activity, then once again the bone density remains high. And then for our parents and our grandparents who have hit the ages of 55, they have hit menopause, then we also can measure and detect whether the level of the bone density is normal or it's rapidly declining. And there are medications that we can give, and we reduce the rapid decline that is seen from the ages of 50 to 55, that is after menopause. And by so doing, we'll have good bone density, will reduce the chances of fractures, which we call pathological fractures or fragility fractures, because the bone is too weak You see our parents or our grandparents, you slip and fall in the bathroom and you get a fracture, which should not be the case. Because we are lengthening our life expectancy. It used to be in the high 50s. I think now we've gone into the low 60s, maybe around 63. That means a good fraction of us are living into 70s and 80s. And the best way to maintain good health is to have strong bones, so that even if you live till 90, you're able to walk upright, as opposed to having fragility fractures. And that's why we used to see our gogos and batiems leaning forward, because the bone density is low and you've had multiple small fractures in the back. So good question. We need to maintain good bone health so that we can have good mobility into our later years in life. For a long while, most injuries that were regarded to be sports injuries were seen being injury to your ligaments, your knee ligaments, your shoulder ligaments, around your ankle. And for a long time, because of the use of purely X-ray, the bone looks okay, and patients would just be given pain medication. But now, with the recent advancement, where we are using MRI more and more, like for us, we have a 1.5 Tesla MRI that is able to pick the types of injury to your ligaments. So is it ligaments on the knee? Is it your meniscus, your collaterals? We're able to identify and see, are we able to treat with medication? Is there value for intervention? Do we need to do surgery? And even for most of this ligamentous injury, we also have arthroscopic surgery, where instead of what used to happen several decades ago, where you open the entire joint, currently we use an arthroscopy machine, where it's a small camera we put inside the joint. We're able to look at the ligaments, and we can add instruments into the same joint and repair whichever ligaments are torn. So that is especially so for the shoulder, for the knee. And the importance of this is, when you have one ligament injured, then you put the other ligaments at risk. And therefore, we need to identify the ligament that is injured, repair it, give it good physio, so that your knee goes back to functioning well. If the ligament persists in the injured position, it's been shown that several months to years down the line, you now injure another ligament and another ligament. And therefore, instead of us seeing the knee arthritis or the hip arthritis coming when you're in your 60s, you get somebody with arthritis in their mid-40s requiring a joint replacement. And therefore, the addition of the MRI is very crucial in ensuring that we can identify this sports injury, be it you've sprained your ankle, you've injured your knee, but it's not on the bone, then we are able to pick this. My advice to those of us who engage in social as well as competitive sports, knowing too well we are in Eldoret, this is the heart of athletics for the world, and we have very many champions, as well as enough sports activity, be it soccer, be it basketball. For them, I would just seek them to maintain regular exercise regime, and by so doing, they are able to maintain fitness, and therefore also when you're off season or something, you still maintain some level of activity, so that you don't pick injuries when the season is starting. We usually see a pattern where after the off season period, we have many athletes and even sportsmen coming with injuries. Therefore, that would be my first advice. And number two, we cannot underscore the importance of warming up and warming down. Our muscles are in such a way that when they are not warm, they are shorter. And therefore, if you don't have enough warm up and then you engage in very rigorous, for example, running or kicking of the ball, then you increase your risk of injury to your muscles. And we've seen a few of our athletes and even our sportsmen getting a tear of their hamstring or their adductor muscles, and it's largely because the warm up was not adequate, and then they went full blown into rigorous activity. And secondly, in case of any small injury, it is good to seek help, and therefore we know with this early injury, do we need to intervene? Do we need to ask you to take a rest? Because, for instance, hamstring injuries have been notorious. When you go back to training before it's well healed, then it becomes a recurrent phenomenon. And we've had a few of our sportsmen having recurrent hamstring injuries simply because the initial one was not well rehabilitated. So in case of any injury, you are welcome to visit us at Top Hill. We'll take good care of you, and we maintain you in perfect health so that you can keep winning medals for Kenya. The term arthritis has been used in different settings, and in essence, arthritis simply means that you are having a problem with the joint or inflammation of the joint. So arthro is the joint, itis is inflammation, and therefore it's been used in different contexts, but I think most commonly in our community, in our setting, are individuals who have advanced joint disease that is impairing their activity, and therefore that is one set of arthritis, and we call that osteoarthritis, that is often seen in individuals who are in middle age and advanced age. And simply put, that the joint has an issue, and as you've correctly said, we grade it. So anyone who's in grade 0, grade 1, they can go on with their activity very well. When you get to grade 3 and 4, then you are in pain when you try and move. When you try moving, at times you are in pain when even at rest. At times you are in pain at night, and it's been shown to be associated with very poor quality of life. And therefore we want to sensitize our community also that for our parents, for our grandparents, when they have hip pain or knee pain, then it's good that you bring them. We're able to evaluate and see, is it a correctable problem? And often when somebody is in their 50s and 60s and they're in pain, they will reduce their level of activity. And the problem with that is when you reduce your level of activity, then the bone density deterioration becomes very fast. And therefore, somebody is 60 with some level of arthritis, the most ideal way is for them to come for review. If they need a total hip or a total knee replacement, then we're able to do that. And with the advancement of technology, the outcome is very, very good for our total hip and our total knee. And by so doing, the individuals will be painless. They can go on with a high level of physical activity. Often it is of economic gain to themselves. They reduce the dependency level. But most importantly is, if they can be active, then the bone density remains strong, then their chances of getting fractures goes down. So for individuals who have joint disease, we are happy to replace this. And that is osteoarthritis. There are other forms of arthritis, rheumatoid or gouty, where it simply refers to the joint is sick with a particular cause. And therefore, for all this, we usually review these patients, do workup, we do some lab tests, and that tells us which is the most likely cause of this. And we are able to maintain the individuals on medication that keeps the symptoms away. More often than not, we cannot say we'll cure it, but if you can keep the level of inflammation low, then the patients can be pain-free, and also it will delay the full consumption of the joint or the full deterioration of the joint. And then what causes the other form of arthritis, the osteoarthritis that we see in our later years? It's usually just excessive use or used over a long time. And then if the one was unfortunate to get an accident and therefore they had a fracture affecting the joint line, when you have a fracture affecting the joint line, then the surface area of the joint bearing the load changes, and therefore the stress goes up and the joint gets finished very, very, very soon. And therefore it's also important, when you have fractures, you come and you are seen by a qualified orthopedic surgeon to make sure that the joint line is restored, and therefore we can delay the development of arthritis. But for those who have developed, we are happy to review them. We are also happy that in partnership with NHIF and the other insurances, we are able to offset majority, if not all, of the cost for repair or replacement of the joints, that is total hip and total knee replacement. In conclusion, bone health is very important for us, for our parents, for our grandparents, and therefore it's good to maintain good bone health in terms of prevention. And when diseases set in, for instance, arthritis, then the earlier we intervene, the better, so that we don't have an additive effect. And also for acute cases, for whether you've been involved in a road traffic accident or you're having an acute joint pain, it's good to be reviewed early, because some of those, when you are late in terms of hours and days, then for instance like septic arthritis would destroy your joint.